Well, it's election time again, and the politicians are telling us the same lies they always tell us. Here's this Adrian Dix, our so-called health minister. I call it the Ministry of Disease and Destruction. So he's attacking the acupuncturists, the chiropractors, the massage therapists, the practitioners of naturopathic medicine, and calling them dangerous. And he wants to put them all together in one group. And then he wants to be the one that appoints the board to look after them so he can muzzle them and keep their mouths shut so they don't say anything negative about what he's doing or how he's doing it. Interesting kind of guy, going to all these colleges and threatening them. What kind of a guy is that? Let's take a look at a few things. He says, let's see how dangerous some of these things are. I'm just going to go through these quickly, but hey, let's take a look at chiropractic. So here's a study that was done. And you know we have a problem with the opioid crisis, and the CDC in the States says that a lot of it is contributed to by the medical profession. But hey, look at this. The conclusions here say that among the New Hampshire adults with office visits for non-cancer low back pain, the likelihood of filling prescriptions for an opioid analgesic was significantly lower for recipients of services delivered by doctors of chiropractic compared with non-recipients. Wow, and look at that. The adjusted likelihood of filling a prescription for an opioid analgesic was 55% lower among recipients, the chiropractic recipients, than non-recipients. That's quite a bit. Wow, that would save a lot of people a lot of money and save the system a lot of money. But Mr. Dix doesn't want to look at that study. And here's another one. This has to do with the Missouri Medicaid for those people who can't afford their full health care down in the States there. Here's what they found. So based on their computations, by looking at what people were spending, they found that three things went on here. Chiropractic care provides better outcomes at a lower cost. Chiropractic treatment and care leads to a reduction in cost of spinal surgery, and most of all, chiropractic care leads to a cost savings from reduced use and abuse of opioid prescription drugs. Wow. Well, I know a lot of people go to massage therapy. I know a lot of people go to acupuncture. They're all wonderful. I know a lot of people that go to naturopathic medicine. Gosh, functional medicine, naturopathic medicine is amazing stuff. It actually helps people get better. It gets them off their drugs. Adrian Dix, who are you working for here? Are you working for the people who elected you? Or maybe it's somebody else. Here's an interesting study. Stats Canada looked at a huge area of preventable disease and death. Look at this. They came to the conclusion that if all Canadians were as healthy as the top 20% of income earners, there would be approximately 40,000 fewer deaths each year and every year. Wow, can you imagine the cost savings? But we're in a difficult time right now where people are losing their jobs. And hey, the politicians aren't doing much about that, are they? Boy, and to think of the future and what that holds for us, wow. There's going to be a lot of people that are dying untimely and unnecessarily. Gee, Mr. Dix, why are you attacking the alternative health practitioners? Why are you coming up with something that you can do for these poor people that are actually going to die and have a significant burden on the healthcare system? Well, let's have a look at the other side of things now. What about the world of medical error? Well, this is a study that was done in the National Post, and here's what it says. Most instances of the Canadian healthcare system hurting rather than healing patients are not even reported by the staff internally. Interesting. So the staff isn't even reporting that there's a problem there. So it must be a lot higher than they say. I don't want to go into this. We could spend months on this. But as many as 23,000 Canadian adults die annually because of preventable adverse events in acute care hospitals alone. Wow. Here's a really sad one. You can look up this study. It's done by the British Columbia government. So over 9% of children admitted to acute care hospitals in Canada experience harm caused by healthcare management leading to death, disability, prolonged hospital stay, or readmission. And remember, they don't report them all. Mr. Dix, what are you doing about that? How dangerous is medicine today? Well, they call it iatrogenic disease. So let's look what this Dr. Gocha has said. He's done a lot of books, and they're pretty revealing books. But basically, he said that prescription drugs are the third leading cause of death after heart disease and cancer in the United States and Europe. Wow. And he goes on and on and on, but I won't burden you on that one. Mr. Dix, what are you doing about that one? Here's another one on breast cancer screening, where they're actually finding more breast cancer and treating people unnecessarily. Whoa, there's another big cost. Mr. Dix, what are you doing about that one? Oh, how about medical devices? Whoa. So I would say at least 8,000 people in Canada are dying from medical devices. And I won't go into that in a big way, but here's some of them here. So just drop this down 10% of these for Canada. But it'd be pretty close. There's a lot of people being hurt with these devices. Mr. Dix, what are you doing about that one? You could save our healthcare system a heck of a lot of money if you did something about that one. But big medicine is big money, and we know it has a big influence on politics. Well, those campaign funds, you have to get a lot of those to get elected these days. But what you don't know can hurt you and even kill you, as we've seen in those studies. Wow. Yeah. Is this more of the same? Corporations over people? I think so. Mr. Dix, start working for the people. How much more could be done with the medical system? Think about it. Yeah, I've about had it. I'm voting independent these days. At least this fella, John St. John in our area, I know him. He's what a wonderful guy, independent business person, helps a lot of people. Gosh, he's not beholden to any party. He doesn't have to toe the party line. He can actually tell the truth, and he does. So I'm voting for him because he's on my side, not the big corporations. Yeah, take a look in your area. Who's independent in your area? Who can you trust in your area? Send a message to the big parties. Tell them you're not putting up with it anymore. You want something different.